My name is Genae Girard, and I am the author of Author-Rack, and I'm also the creator of Beyond the Booby Trap. And today I'm very, very excited to be here with an actual physical therapist who's somebody that we really need to look for, seek out, find the right people in our community that can actually help us move forward. And this is Angela Wicker-Ramos, and so happy to have her here. We've had a lot of questions revolving around lymphedema, around some of the issues that we've been having. So I actually went out and asked you what you wanted to hear about, and so that's what we're going to talk about. So welcome, I appreciate you being here.
Great, thank you for giving me this opportunity.
I love it. So, okay, first off, one of the questions that I get a lot is, should I wear a compression sleeve if I've had nodes removed, and what's the importance of the sleeve?
The first thing to keep in mind is with axillary lymph nodes, or the lymph nodes in your armpit, people have about 30 to 40. And so when you have lymph nodes removed, the importance is how many you've had removed as to the risk of lymphedema and the risk with flying. Usually if you've had 2 to 4, something that's just to be tested, your lymph nodes to be tested, then I recommend you don't really have to worry about a sleeve unless you start seeing swelling. However, if you've had about half of them removed, I usually recommend just talking to either your physician or your physical therapist about getting a sleeve. The most important time to wear it flying is when it's about a 4-hour flight, something where you're going to be really stationary and not moving for an extended period of time. Also, when you're on a plane, you have less atmospheric pressure pushing down on your skin, so people are more prone to swelling anyway. So if you have fewer lymph nodes, since lymph nodes are involved in decreasing swelling in your body, then if you have fewer lymph nodes, you're going to be more at risk for swelling during travel. So I recommend, if you're not sure if you need to wear it or not, you might as well get one just in case if it's going to be an extended flight, because it'll just decrease the toll on your body and decrease the swelling.
Now, some of the women in my group, they talk about the fact that when they appear to be more active and moving around, maybe lifting and things like that, they notice more swelling and it starts to get a little bit more severe. Why is that? Why is it when you're active?
Well, what your lymphatic system does is on a regular basis, it's moving fluid that's normally in your tissue spaces back into your circulatory system. So with increased activity, there's generally increased fluid movement or circulation throughout your body. So if your lymphatic system can't pick up that excessive fluid because it's injured in some way, then you're going to have increased swelling with that. So that's why I recommend, if you already have swelling, just wear some sort of compression that's recommended to you by your physician or by your physical therapist to just prevent that from happening. But new research has shown that with lymphedema, it's actually encouraged that you do gentle exercise within your doctor's okay or your physical therapist's okay to actually decrease the amount of swelling you have. So it's not something that should be avoided. You just need to make sure that you have some sort of compression when you're doing it.
Okay, so if I've been through surgery and I've healed up, but I'm starting to see restriction in my movement, whether it be from node dissection or my mastectomy surgery, what's the best way to go out and find a physical therapist that is qualified for this process?
It does take extra coursework. So the therapist has to have taken a few courses in oncology or breast cancer rehab, because there are specifics to that sort of patient population that need to be addressed. One way is you can actually go on to the Academy of Lymphatic Studies or the Lymphology Association of North America's site and actually look up physical therapists that are certified lymphedema therapists. That's one way, because if you're a certified lymphedema therapist, you have training in oncology rehab. Otherwise, I would call different physical therapists' offices and ask if they've had extra training, and you can even ask which courses they've taken.
Okay.
So yeah, I would recommend that, because there's the very specific things that need to be known when you're working with patients who have undergone cancer treatment. Okay,
so not only with lymphedema, but also, like, I had node dissection, and I noticed I had a limited range in my motion with lifting my arms and also cording, which to me, the best way to describe it to all of our group is that it felt like someone was reeling in a fishing line and the tension was there. Is that something that a physical therapist can help with? And if so, what does that entail?
Yes, cording, actually what it is, it can be multiple factors, but basically it's adhesions or scar tightening of your lymphatic vessels or even of the veins and the arteries in the area, because in your armpit a lot of stuff comes out from that area, arteries, veins, and your lymphatic cording. So the actual lymphatic cord becomes taut. And so physical therapists can help with gentle stretches as well as manual techniques to kind of loosen up that cord, increase the circulation of your lymphatics to release that. It's also called axillary web syndrome is another thing that's called.
AWS? Okay.
Yes. So a lot of times it resolves on its own. So it's not something that you would need immediate assistance unless it's really painful, really limiting, or is not resolving in a few months after your surgery.
Okay. And then also, I know a lot of the women in our group, they have fluid buildup in the limbs and even the back and the shoulder area. So what do you recommend? I mean, is that something that they come in like weekly and do lymphatic drainage type massage, or?
Well, I mean, depending on what we find in the evaluation, everyone's course of treatment's a little different. But the way I approach it, because if you have swelling that you're dealing with, most likely you're going to be dealing with it for an extended period of time. So I work really hard on educating the patient on how to do their own manual lymph drainage, how to have the appropriate compression and exercises to help improve that lymphatic circulation. And then depending on the severity of the swelling, they can come in for regular manual lymph drainage for a few weeks until they're independent with doing it on their own. There's also compression pumps, if that's necessary, that they can have at home to kind of help the circulation of your lymphatic system.
Is that something that's electric that helps you with?
Yeah. It's like there's like this. It's a sleeve that you put on, and then it uses air in different panels to help kind of push the fluid up towards your heart, basically.
Okay. So basically, depending on the severity or what they're dealing with, they can come in, and I love the fact that you can actually help them do some of it on their own and learn the proper way, because that way we can, you know, take care of ourselves too, and you know, continue to work. So, okay, so we're gonna actually do some footage that's going to show a particular tape, and that tape is called
Kinesio tape.
Kinesio tape.
Yeah.
And this is a particular tape that you can explain how it works.
Sure. It's got a certain elasticity to it, so it actually lifts the skin up a bit, so it increases the circulation in the area underneath the skin. So if you have a certain amount of swelling in the area, just by lifting up the skin, it can increase your lymphatic circulation with the taping. And it's something that a patient can do on their own, or I can do for them as well.
Okay. Okay, so we are here with a specific tape that you had mentioned, and can you tell us a little bit about how this works?
Yes, so with kinesio taping, basically we're trying to use your lymphatic collectors to push the fluid up to an area where your lymphatic system can pick it up. So right in here, I'm basically, let's say she had swelling right in this area here. With this particular taping technique, it helps assist the fluid lifting up the skin so the fluid can move up to her healthier lymph nodes up in this area right in here instead of underneath the armpit where she's had lymph nodes removed. So it's basically trying to reroute fluid to an area where it could be picked up by healthy lymph nodes.
Now, would this be something that you would put on like per day, or just when you had issues, or is it preventative?
You know, I usually use this with mild lymphedema, where it's something that, you know, just whenever the swelling, you know, increases depending on you having increased activity one day, or you were out in the sun for an extended period of time. If you have increased swelling, it kind of just kicks in that lymphatic system to work a little harder. So it works really well with mild lymphedema just to get the swelling out of the system.
So whether or not you have lymphedema or whether or not you've had nodes removed, what are some things that you need to avoid and be very careful about, you know, in this type of situation?
Well, your lymphatic system has two purposes, and the first purpose is actually part of your immune system, so it helps eliminate any toxins in the body. Right. So one thing that you want to keep in mind when you've had lymph node removal is increased risk for infection, so you want to avoid sunburns, cuts to the body, insect bites, that sort of thing, because that just increases the toll on your lymphatic system to try to eliminate any risk for infection. So I tell people, if you're gardening, if you're cooking, you know, just protect yourself from the heat, protect yourself from cuts. Also, you want to make sure that you prevent overheating, so I would avoid hot tubs, saunas, that sort of thing, especially with the arm that you're at risk for the lymphedema for.